Good morning. Everyone's all set up? 2 minutes early today, Lane, just for you. Made up for yesterday. Who are we waiting on? Is he coming? How many cameras? It was a good one. Can I start by wishing the Queensland Women's State of Origin team all the best for their match tonight. We hope they, and we are sure they, will do Queensland very, very proud. We are reporting 2 new cases of community transmission in Queensland, both in quarantine contacts of that known case related to the Portuguese Family Centre. That means we now have 41 active cases, 1,679 total cases since the pandemic began. We did 8,995 tests in the last 24-hour period, and we vaccinated 13,805 Queenslanders, bringing our total to 491,587. As you'd understand, we continue to monitor the situation related to the Sydney Delta variant outbreak very closely. That continues to expand, and we'll look forward to that update from New South Wales later today. It appears to continue to be largely contained to the Greater Sydney area, although there is one case of transmission of somebody who was in Sydney, went to Melbourne, and has then given it to another person in Melbourne, underlining just the risk that this outbreak could spread to the states. At 1 a.m. this morning, we further lifted restrictions, including from people in the Victorian hotspots. Yesterday, police turned around 186 people who attempted to enter Queensland by air, and they were sent back to Sydney, and 128 people who arrived were put into hotel quarantine. We're expecting a further 41 cases today. As I say, that Melbourne case, as well as concern about the number of people from Sydney who will be holidaying alongside Queenslanders in northern New South Wales, just means we need to have better visibility on people in the northern New South Wales area travelling through there back into Queensland. And so until now, we've exempted people within that northern New South Wales border bubble from needing a border declaration pass. Because of the school holidays and the New South Wales outbreak, the Sydney outbreak, we will be requiring those border declaration passes for everyone who crosses the border for the period of this New South Wales outbreak. Now, these passes last for 14 days, so for people who come and go across the border regularly, they will only need to apply for a pass every 14 days. Let's hope that the New South Wales outbreak can be contained within, say, 14 or 28 days, meaning people only need to apply for 2 of those passes. Those restrictions will come into place at 1 a.m. on Monday. Now, before handing over to the Health Minister and the Chief Health Officer, I just want to address the proposal received late last night from the Prime Minister for a quarantine facility in Pinkenba. And can I underline that we certainly welcome that the Commonwealth is finally giving consideration to supporting a Queensland quarantine facility. Of course, it needs a lot more work. This was a 1.5-page letter received by us late last night, just after it was provided to the Courier Mail. The only detail in the letter is an address. And I'd just note that when Queensland provided a 15-page early proposal, we were told that that was far too little detail. Now, we will work with the Commonwealth through that detail. Our officers have already started analysis on that site, but there is a lot more work to be done. The proposals that we had been working on were for regional quarantine facilities. This clearly won't be a regional quarantine facility. This will be an urban quarantine facility, and that will require different arrangements for infection control and for keeping the community safe. So our officers will work with the Commonwealth to determine how that can be done. I think what Queenslanders liked about the regional quarantine proposal was the distance between this facility and people's homes, distance between the facility and an urban area, and this Pinkenba proposal is in the suburbs of Brisbane, and so we'll need to consider that very, very carefully in working up the proposal. And we would certainly welcome if the Commonwealth has done any more work other than the letter that the Prime Minister sent us last night. We'd certainly welcome them providing that to us and welcome them working with us for how such a facility can be safely designed and developed. Yvette?
Thank you. And so our message to Queenslanders, as we start easing restrictions in Queensland, we can have more people in venues now. We can have self-serve and buffets happening again. We want to remind people that to maintain these levels of restrictions, being the lowest in the country, we need to be vigilant. So if you are feeling unwell at all, please stay home. Go get tested and wait for your results. As we've seen with what's happening in New South Wales, this is now transmitted to Victoria. We need to be cautious and we need to ensure that we are doing the right thing by ourselves and by our community by getting those tests done. So we want to see our testing levels stay high. I also want to congratulate all of our vaccination centres and the staff there for great numbers. We are certainly on track of delivering at least the same number of vaccinations last week, which was over 85,000, potentially even 90,000, depending on how many vaccinations we do over the weekend. So it is more important than ever that you get vaccinated. If you are 60 or over, please book in with your local GP, or if you're in the regions, a pharmacy if they are available and accredited. Alternatively, if you are under 60, from 40 to 59 years old, or you are a 1A or 1B, a frontline worker, please reach out to our community vaccination hubs and come and get vaccinated. The sooner you are vaccinated, the sooner it protects you, but we know when you're vaccinated you can still spread it to other people. It's about keeping you safe so you don't end up seriously ill in hospital. So I thank Queenslanders for all the great work they've been doing. This travel declaration change for the New South Wales border areas is important. It's a very simple process. It'll take them a matter of minutes to do a travel declaration, and as the Deputy Premier said, hopefully they'll only need to do one, maybe two declarations if New South Wales gets on top of their transmission within 28 days. But it is important so that if we do start seeing any transmission with people from Sydney potentially holidaying in Byron Bay or other areas of the north coast of New South Wales, then we will be able to let them know and say, you've been to New South Wales, please go get tested. So we do ask everyone who has been in New South Wales in the last couple of weeks, keep checking the website for exposure sites, because we are continuing to see new exposure sites being listed in New South Wales, and also in Victoria. We'll need to keep an eye out on any exposure sites if you have travelled there in the last few days. Dr Young.
So 2 new cases acquired in the community overnight. Both of them were during their infectious period in quarantine, so not a risk. So we now have 7 cases related to that cluster, related to the lady who came from Portugal. So I'm not concerned about that, but we are continuing to see cases in New South Wales, so it is really important that we could have any case in Queensland any day. So please, as Queenslanders have been doing for now the last 18 months, any symptoms at all, immediately come forward and get tested and isolate till you get a negative result. I want to thank all those people who were at the DFO last Saturday. Could I ask, if you haven't yet been tested, because I didn't want you to be tested early because it was so fast, there was no way you could have been infected, if you could please now come forward and just get tested, even if you don't have any symptoms. So those are those people who were at the DFO between 4 and 4:30 p.m. last Saturday afternoon. That's really important. I know the public health people have been contacting most of you, but just in case there's been anyone who's missed, please could you come forward and just get tested so we can make sure and be very confident that we haven't had any ongoing transmission. So all of that is important as we go forward, and as the Minister has said, this is the time for Queenslanders to get vaccinated. It is really important. That is what will stop outbreaks happening.
The two new cases, were they at the Portuguese Family Centre?
Yes, so I only just got this information before this press conference, so I do need to clarify it. But I understand one might be the partner of the manager of the restaurant, and the other is someone who spent that day travelling around with that lady from Portugal. But I just need to go and clarify that information because it's only just come through.
In quarantine? Had they
Yes.
isolated once they knew?
Oh yes, our contact tracers are really good at this now, and they immediately last Sunday got hold of all of these people and asked them all to go into quarantine in their homes or into a hotel, depending which group they were, and be there. So they've been in quarantine their entire infectious period.
How far south in New South Wales are required to get to the border declaration?
Anywhere. So now, just to make it very, very clear, because it was actually getting very confusing who needed to fill out a traveller's declaration pass. So now anyone travelling into Queensland from anywhere in Australia needs to fill out that border declaration pass within 3 days prior to travel. Then they need to complete it every 14 days or earlier if their travel patterns have changed over that period. But if they normally live in Yamba and cross into the border into Queensland, and that's what they do because they're coming up here to school or work, then they just need to do it every 14 days. But of course, if they were to travel from Yamba down further south, they would need to complete it again.
So with all the people crossing the border, how are you monitoring that?
Well, the police have already started doing that, so they've been putting in place those random intercepts and checking and monitoring people. So it just means that at the moment, if someone's come from the border zone, they don't need to have done it. Now they need to have done it. So when the police randomly intercept, they'll find people.
How worried are you still that you might seep into regional New South Wales?
I am very worried, yes. So this is why I've asked for people, no matter where they've been in New South Wales, to go and use that traveller declaration pass, because it's a fantastic pass. It gives us the information so we know where people have come from, so we can immediately go out and contact those people if a case then happens in that area. I think this is something we need to explore very quickly and work through it.
Would there be any risk to residents around the area?
Well, that's what we have to explore. That's what we have to put in place to make sure. Remember, we've had really good hotels here in Queensland managed by police, intermittently with support from the ADF, and We've had people leave those facilities, but they've been found very quickly. So similarly, systems would have to be put in place, no matter where the facility was, anywhere in the state.
To protect the public?
Yes.
What's stopping you from doing a total shutout to New South Wales at the moment, given those concerns in regional areas?
Well, we've not seen transmission outside Greater Sydney, and New South Wales did put restrictions on travel for the riskiest 7 LGAs, so people who live in those very risky LGAs in eastern Sydney have been told they can't leave those LGAs except for essential reasons, of course. So they've put that in place, and there's a lot of messaging. Plus we've put, of course, our restrictions for Greater Sydney, including the areas surrounding Greater Sydney. So they're in place, and at this stage we haven't seen transmission except those cases that went down to Melbourne, that they came out of Greater Sydney. So at the moment I'm reasonably comfortable with the position we're at.
Do you think Greater Sydney should go into a snap lockdown?
That's a decision for Sydney to make, for the New South Wales government to make.
There's a number of events in northern New South Wales that Queenslanders may be travelling to for school holidays. What's your advice to them? Should they reconsider travel?
I believe at this stage everyone in Queensland needs to reconsider whether or not they need to travel to New South Wales. At the moment, There are no cases in northern New South Wales, but of course, as we know, they start their holidays today, so there is potentially people in Sydney who may have been coming up to Queensland who will be going to northern New South Wales. So people should really reconsider their need to go anywhere in New South Wales. If it's urgent, unavoidable, of course they should travel, but if it's not, perhaps they should think about holidaying in Queensland.
Thank you. On the quarantine hub, AMAQ says the barracks look like the perfect site, but given its size, security may be an issue if people try and jump the fence. Is that those elements things are going to be looking into?
Oh, look, they're all things we need to consider. We were provided this address late last night. We've looked at it on Google Maps, but we'll need people to get out there on the ground, look at how a facility can be developed and kept safe. And I just emphasise that we have on the table a very detailed, highly costed proposal that could be built now. We could go ahead now, but instead the Prime Minister wants us to start from scratch with this other proposal. Now, we've said we'll do that, but I would hope that we can keep both proposals under consideration. They can be compared over time, but this proposal, first of all, could have been built already. Second of all, no doubt would be built faster because it's so much more advanced.
Are you surprised that Feds didn't come up with this proposal long before now?
Well, it does seem strange to me. It was one of the sites that our departments were able to identify as a potential Commonwealth-owned site. How and why it took the Commonwealth so long to choose it, well, they're questions you could put to them. Look, I just think it's a shame that it's taken this long for us to get any real level of engagement. We've been our Wellcome proposal, I think, has been on the table now for 5 months.
So did you say you had proposed this site to
We did an audit of sites. It was one of the sites that was identified as a possible location. It was in part ruled out, I understand, because of contamination and asbestos in the buildings, the very old buildings at the barracks there. However, the Commonwealth then told us that they'd assessed all of the defence sites and ruled them all out, and so I'm not sure what's changed here, but as I say, we welcome this engagement. We're happy to work on Scott Morrison's proposal. We would, though, urge him to continue to consider our proposal because we can get that built much, much quicker.
When do you hope to respond to the Prime Minister?
Well, it's taken them 5 months to not give us an answer on Wellcamp. We've got this. We've had this for 12 hours, so we'll get to work now on it. Our officers will get to work now on it. It will depend how complex it is. As I say, there are a whole range of. There's planning issues. There's water management issues. There's lots to consider. This is a big development. This is 1,000 cabins is the proposal. So we'll need to work through that. We'll need to look at costings. We'll need to look at cost sharing. We'll need to look at staffing arrangements, health arrangements. All of the detail all of the effort that we put into Wellcamp will now have to redo because this is a very different prospect.
How many people will be vaccinated at the end of the year? We're hoping that they'll be vaccinated at the end of the year with a 7 years.
Well, I think it's interesting. I think some of the commentary suggested that this facility wouldn't be up and running until next year, and I think that starts to give you a sense of what the Commonwealth thinks the timeframes on the vaccine actually are, but we hope to have people vaccinated sooner, and certainly if we get the supply that we've been committed, then we would expect to have people vaccinated sooner. That doesn't mean that there won't be a role for a quarantine facility, though. We want to see, as well as Australians returned safely, we want to see the return of international education. We want to see the return of international workforces, backpacker workforces, agricultural workforces, hospitality workforces, even medical workforces that rely on people coming from overseas, and a purpose-built facility could allow us to do that safely. So there may well be a role for that quarantine well into the future, even after everyone in Australia is vaccinated.
Do you now accept that Wellcamp is dead?
Well, no, I think Wellcamp remains the only proposal of any detail on the table, and we could go ahead with it now. The Prime Minister has provided us an address overnight, and we're happy to go and have a look at it.
How many beds is Wellcamp?
So the Wellcamp proposal is scalable, but it did propose a facility of around 1,000.
And do you know how many people are currently in
The Chief Health Officer might have that detail.
3,500.
So it means that you would actually need more facilities than just 1,000 bed facility, so you'll have to look at multiple.
Certainly this facility could not replace or supplant all of the existing hotel quarantine capacity. It would allow for additional capacity, though, as I say, to bring in those other cohorts. But we would continue to envisage a level of hotel quarantine going forward under either proposal. The Wellcamp proposal, because the amount of space there was scalable and could have been expanded above that level. But stage 1 proposed, I think, 1,000 beds.
How would this be different than
Well, this would allow for purpose-built facilities, probably cabins where people, rather than opening their door into hallways, they could open onto, for example, a small balcony or a courtyard, which would greatly reduce the infection risk. That's what we've been saying is the concern with these new strains is that they appear increasingly able to be transmitted within the hotel environment. Hotel rooms are positive pressure; they push air outwards into an enclosed space where we have workers moving about those enclosed spaces. The hallways, they're not ventilated, so it would be much safer from an infection point of view if the rooms opened out into the outdoors.
I just have a few questions about the check-in app and the new requirements for businesses. Any idea how many extra businesses have signed up now for the check-in app?
I'm not sure if we have that. We haven't got that. We're happy to provide it, though. Yeah. Who's going to a buffet for lunch? Is anyone going to a buffet for lunch? I think they're the same thing, aren't they? A smorgasbord's classier?
Self-serve food.
Smorgasbords are bigger.
We've had a few businesses saying it's a bit confusing. Like, does it apply to if you get takeaway coffee or if you go to a bakery, for instance? Is there going to be a more comprehensive list
Do you want to
of
do
businesses that are affected?
There is. So we've been working to refine that list to provide clarity to businesses. What we're looking for is any business that has face-to-face contact with the community, with the public. We need you to be using this app. So even when we do put the full list out, even if you're not on that list, we strongly encourage you to use this app. And I'm already seeing bakeries and takeaway places. Just in the last week, I've walked into many venues that even though you're simply walking in to get some takeaway, including one of my local pizza joints, I'll give them a shout out this week, that they had their check-in app, even though I was just there picking up for a few minutes. But I was standing there, standing around other people. And what we know about the Delta variant is it's very easy to transmit, fleeting contact. So even though you might be just standing there for 5 minutes waiting to pick up some takeaway, there is a risk there, and it's a risk not worth taking. We've got a great contact app. We encourage every business to use it.
When's that list coming?
Look, I'll check with my office. I did see a comprehensive list a couple of days ago, so I would have hoped it's already up on the website, but I'll check on that and make sure it's up.
Do you know if it includes fuel stations, like a servo or individual retail stores?
So yes, the intention was it would include individual retail stores because what we've seen, and New South Wales is a really good example with Westfield and Myers, is that we have people who go into a big shopping centre, might not go into individual retail stores, but they might wander around, just look at shop fronts, they might sit in the food court and eat. So we want to capture those people, so we want them scanning as they walk into the shopping centre, but also as you go into other centres, because they could be a big supermarket, they could be a large retailer like Myers, which is what New South Wales has seen. For us to be able to narrow down and say, you've been at Myers that day, we can contact you and say, please contact us and narrow down whether they've been there in the exposure time frame. So it's all about keeping the community safe. It's a really simple app and we encourage everyone to use it.
For elderly people who might not have a smartphone, what's the option?
So look, we'll continue to work with businesses around elderly people. There's a couple of options here. We will allow where it is absolutely necessary, the paper-based system where that data is being entered into electronically every day by that business. but the business will have to show that they should still have the check-in app there. They are still required to have the check-in app, and also they should also have a mechanism where businesses can register people. So it's not going to be as simple as, oh, well, you know, our older citizens can't use this, so we've let everyone fill out paper. The compliance officers will be looking very closely at what measures you're doing and how you're ensuring that everyone who can do it will do it, because it means we can contact trace far quicker. And again, when you look at what's happening at New South Wales, timing is critical. And you look at what we faced in the last few days in Brisbane here, we got onto this on the same day. Like within 24 hours, we knew we had a positive case. Within 24 hours, we were doing contact tracing and we were putting people into quarantine, which is why we can stand here today and go, yes, we've got a couple more community cases, but there is low to no risk because those people have been in quarantine before they were infectious. So it is really important. But businesses can check people in. So if you're a cafe, then you can have your own tablet or phone there where someone who cannot check in, the business can check in for you. And of course, I remind everyone, we've been doing this for a while now, if you're going in with a group, as long as one person in that group has a phone that can scan, they can check in people for you. And you can add to your lists of people that you go out and have a coffee with, and you can check in all of your group at once.
Dr. Young, just quickly, can I ask, we had some news yesterday that Dr. Bennett is departing her role. Who will take on Queensland's COVID response once you both depart?
I'm not departing till the 1st of November, and I will be here every day till then, and will continue to manage it. And I do have a fantastic team, so there are a lot of other people, and we're immediately, of course, looking at additional people.
Thanks very much.
Thank you.